For John Marine, this was really the room where his life changed. He was on a path where his life was probably going to be extinguished. His life changed right here on this table.
The pain I was feeling, for some reason, I felt like it was something serious. It was unlike anything I'd kind of felt before in life, and it just felt very ominous to me for some reason. My name is Jonathan Marine, and I'm 24 years old, and I came to Union Memorial Hospital in July because I had an aortic aneurysm. Yeah, when they brought me in, I felt like I was in a spaceship. Yeah, I don't remember much. I just remember coming in, and it was really cold. I remember my vitals were up on the plasma. Didn't know what to make of it, I guess you'd say, and I was almost catatonic. It felt like system overload, too much to handle. It felt like everything was out of my hands. It was surreal. It was very surreal because there's all this movement with the different people all doing their assigned tasks.
Once we had him in the operating room and we were in control of it, we could see that he was imminent rupture, no question about it. It leads to death. There's very little likelihood of him being saved if that happens outside the operating room.
When I had to, tell my mom and tell my sister what was going on, and hearing their reaction, it really set in for me.
His aorta was very dark looking, and it looks dark because the wall has become so thin that you can actually almost see through it and see the blood on the other side of the wall. To be in this new floor, in these new operating rooms, certainly makes it much easier to do complex cases. I have the ability to have multiple monitors around the room where I can see his vital signs. I can also bring up pictures so I know what the heart looks like, what the valve looks like. I can have a screen right in front of my face that shows the echocardiogram. It also is a tremendous teaching tool for everybody in the room. They can see what I'm doing. Even if they can't look directly into the wound, they can look at a monitor and see one of the cameras that are pointing in the wound, and they can say, okay, Dr. Fiocco is going to need this stitch next or this graft next. And so it just makes it easier, and it makes everybody more involved in the case, and it makes everybody in the room better because of that, because they understand more of what we're doing. Having
the room to myself, having privacy when my family and guests came by to help me feel better, that is an aspect of the recovery process that I don't know how I would have done without, because it, again, made me more comfortable about how things were going. It allowed me to kind of recover with high spirits and high hopes